can't believe we made it to chemical peel season. I'm sure you are seeing influencers and estheticians all over your social media page talk about peeling, getting chemical peels, and what to expect during your chemical peel. Hi, my name is Raven. I'm a licensed esthetician in Scottsdale, Arizona, and this is everything that you need to know about chemical peel and why it's not actually as scary as it may seem. If you're scrolling through social media and looking at chemical peels, it may look like some zombie-esque treatment to get a couple times a month to see a difference in your skin. Only half of that's true. You don't always have to end up flaky, crust, red, and wondering how you're supposed to go out in public with your skin looking like that. In reality, chemical peels are a controlled way to produce trauma to the skin to not only increase the rate at which collagen is produced in the skin, which literally just means making your skin more firm and plump, but then it can also help if you're struggling with acne scars, cystic acne that is either enclaved into the skin or being prominent into the skin. Chemical peels can help get that dead skin off, texture, pigmentation, and overall glowiness in the skin. Today I'm going to break down everything that you need to know about a chemical peel. What exactly is a chemical peel? Does everyone peel during a chemical peel? What is frosting? Because that can happen during a chemical peel. What type of chemical peel is right for you? And what to do before and after receiving a chemical peel. So if you like skincare videos like this, definitely like this video, comment down below any of your questions, thoughts about chemical peels, and hit the like and subscribe button for more videos. A chemical peel is basically a controlled form of exfoliation on the skin. It uses a variety of chemical exfoliants to dissolve any dead skin and break up any bonds, preventing the skin from glowing and from healing. The acids in the peels break down the bonds of dead skin that is preventing your skin from being bright, dully, or even getting rid of hyperpigmentation. It does this by letting them shed or flake off, or just by increasing the rate at which cell turnover happens. This controlled injury triggers your skin to make new cells, revealing smoother, brighter, and healthier skin underneath. The depth of the peel really just matters on how deep of a chemical peel your skin can handle and what exactly you're wanting to take away from the treatment. You have superficial, medium, and deep peels. Superficial peels will be little to no peeling. Medium peel was when you start getting that flaky, crusty peel. And deeper peels is when you see a complete transformation in the skin and it has the most peeling of all. The higher you go in the terms of how deep your peel will be, a longer wait time after your treatment and longer time that you have to stay out the sun. Be consistent with your skincare routine, and instead of just peeling the dead skin that comes in and that's flaking away, you actually have to cut it off with some scissors to prevent further damage. If you want a pretty deep peel that has a lot of intense peeling, that's when you go into the more deeper peels. Chemical peels work in three main ways. First, you have the exfoliation that's breaking up the bonds between dead skin and hyperpigmented skin, making the skin peel or even increase its cell turnover rate. Chemical peels also give your skin a collagen boost. Your skin sees the peel as a small injury, so it produces more collagen, leading to firmer and plumper skin. Also have pigmentation reduction because the chemical peel is breaking up the melanin that is producing the hyperpigmented skin in the first place. Acids in the peel break up that hyperpigmentation. There are so many different types of peels, and the type of peel that you get really determines on your skin needs and what your skin can take. More superficial peels are peels like glycolic and salicylic acid that work really on the first top layer of the skin and don't dive as into the skin. This is great if you want to get rid of fine lines, wrinkles, and mild acne. Salicylic acid or glycolic acid, or even a combination of the both, have the ability to dive deep enough into the skin to give you those results that you're looking for. You may not always peel, but you'll still get the same result as having a mask that does peel. When you start to get into deeper peels like TCA peels and Jessner peels, that's when you're gonna see the most intense peeling that requires more downtime. This is when you go on Instagram and TikTok and you see the girls that have super hyperpigmented skin and post-inflammatory hyperpigmented that go in to get these peels. This is for the people that have very intense sun damage and really deep wrinkles that they want to see a difference in. Now, what does all this mean? Does everyone peel when they get a chemical peel? The short answer is no. Everyone does not peel when they get a chemical peel, and that is perfectly fine. That doesn't doesn't mean that if you don't peel, you don't have good enough results, or if you do peel, then something bad happens. Peeling is an essential part of the process to get rid of that dead skin and have it flake off. When it doesn't peel, it's just not a peel that needs to be that deep to get you the results that you need. It's a pretty surface layer peel. And this is pretty good to have, especially as one of your first peels. You don't want to go in damaging the skin. If I, as an esthetician, give you a peel for the first time where you're peeling a lot, you're flaking a lot, this is actually going to have the reverse of what you want in your skin. Instead, you're going to get a lot of post-inflammatory hyperpigmentation. This can damage your skin barrier, almost take you 50 steps back from what you originally came in. Usually when you get a chemical peel, this is after a series of having more intense treatments that can build your skin tolerance up to getting those more intense chemical peels. Even with your most superficial peel, you might not have your skin literally lifting and coming off, but you will have some type of flakiness in the skin, and you will also have something called frosting. Frosting is when your skin turns white during a peel. This usually happens with TCA or more medium to deep peels, but it can happen with superficial peels. But what does this mean? In the skin, what's happening when your skin frosts? The acid from my chemical peel is reacting to a protein called keratin that's found in your skin and makes this frosting reaction. The skin that is frosting is actually dead skin. So in real time, you are seeing that dead skin dry off and get ready to flake. If you couldn't tell by now, frosting is really good. It's telling us that the chemical peel is doing its job and getting rid of the skin that doesn't need to be there. Typically with frosting, you're gonna see that first before you start seeing any real peeling, all the deeper effects go on. This is gonna help with any concerns that you have that really brought you into the treatment room to get a chemical peel in the first place. So that's acne scars, wrinkles, or even hyperpigmentation. So when you see frosting happening during your chemical peel, that's actually a really good sign. If you don't see frosting in your peel, it's also a really good sign, because this means that you have a beginner peel and your esthetician is actually building you up to the process to have that frosting and to have that flaking or even peeling off. However, we don't want too much frosting. Too much frosting means there is a lot of irritation in the skin, and that can actually lead us a couple steps backward. But if it does happen, it is okay, nothing to stress about. Just keep the skin super moisturized and protect it daily with sunscreen. Now, what do you do before and after your peel to prepare and to make sure that you're not causing any further damage to your skin after you get this chemical peel? So before your chemical peel even starts, as I mentioned before, you should be doing a series of treatments that build up your skin tolerance to even get this chemical peel. About a week to 3 weeks before your chemical peel, your esthetician will give you a pre-chemical peel set. This set is gonna build your skin's tolerance at home instead of just relying on the treatments that you're getting once a month in the treatment room, so that you can have a more effective chemical peel, and even kind of starting the process of giving yourself a chemical peel at home by doing heavily exfoliation with retinoids or even glycolic acid. About 72 hours before your chemical peel official appointment, you want to stop using those retinoids and glycolic acids on the skin to prevent further irritation and to prevent too much frosting going on during your actual chemical peel treatment. Proper preparation for your chemical peel reduces the chances of things going wrong, while also making the process a lot smoother by not providing any irritation before we're going in with such an intense chemical treatment to treat the skin. On top of using glycolic and retinoids before your peel and then stopping 3 days before, your esthetician is also going to give you a series of cleansers, toners, moisturizers, and sunscreen to use to keep your skin hydrated and protected from the sun, as you're using these products are going to cause some more sensitivity. And also, after your peel, you're going to be going in with these same hydrating and moisturizing, these same hydrating and protecting. After the peel, you want to make sure that you are not forcibly peeling the skin that's already starting to flake and peel off, because this can cause even more post-inflammatory hyperpigmentation. You also want to stop using any harsh exfoliants on the skin that's not recommended from your esthetician, because you already just went through an intense treatment that has chemical exfoliants and has all these exfoliating factors in it. You don't need to keep using those on your skin after the fact, because it's just going to make your skin more sensitive. The thing that needs to be engraved into your skin is making sure that you are wearing sunscreen. Sunscreen is a complete non-negotiable if you are getting a chemical chemical peel, and wearing sunscreen or even the lack of wearing sunscreen is the reason why estheticians will not give chemical peels to everyone. Chemical peels can really damage your skin if they are not done correctly. Sunscreen will protect your skin from the harmful UVA and UVB rays that causes further damage into your skin when it's already in a sensitive spot. That's almost like getting a sunburn and then immediately going directly into the sun with no protection. You are just going to end up going back on your results and not being able to do this treatment in the future because of how sensitive your skin is and how it reacted after the treatment. Any peeling that you experience after your treatment is completely normal and should not be anything to worry about. Instead of forcefully pulling back any skin that's being done, just cut off the skin and then softly pat in your products such as your moisturizing products, cleansers, and SPF. But enough about post and after care. Let's get into the real juicy stuff. How do we know which chemical peel is right for us and how deep we can go into the skin? This is all done through your esthetician or your dermatologist recommendation. Typically when you're starting out, or if you just want a really light flakiness, not anything too crazy, you're going to be doing an AHA peel. This is good for both acne and fine line wrinkles that are pretty superficial on the skin and aren't as deep. Glycolic pills are suited for the girlies that are looking to really bring in that hydration to the skin and make it look more plump, almost like that instant glow Korean skincare look on the skin. Glycolic acid peels would be wonderful for this, as well as reducing any texture in the skin. Unlike my favorite glycolic acid toner by The Ordinary, glycolic acid peels have a higher concentration of glycolic acid in it to overall bring brightness and evenness to the skin. TCA peels are one of my favorite peels to do, especially for my clients that have a lot of wrinkles, acne scars, and really deep hyperpigmentation that they had for years that they want to get rid of. TCA peels are more on the deeper to medium side. With TCA peels, you are going to experience some type of flaky or sheddiness as well because of how deep the chemical peel is able to go into your skin. Lastly, we have Just Nurse peels. So these peels are more something that you can get from a dermatologist, but these are to oxygenate the skin as well as even more dramatic results and even more peelings. You have really deep acne scars that's been around for years, or if you have really deep hyperpigmented skin that you want to get rid of, that's when you start seeing a dermatologist to get a Just Nurse peel. This has the highest downtime out of all the chemical peels that I have talked about today, and where you go into more of the medical side and you need to have a prescription for pain medicine afterwards. Overall, chemical peels are the best thing to get if you have acne scars that you want to get rid of, really deep wrinkles, if you're looking to help even out your skin tone and minimize the look of pores. Chemical peels don't have to be scary. It can really be something that's very exciting and very transformational in the skin. Really take your skin from having really deep and obvious hyperpigmentation to having a lighter and more even skin tone. I know social media can show you the most intense peels that happen and the most intense dramatic results, but it really doesn't have to be that way, and 9 times out of 10 those people were built up to get that deep of a chemical peel. So if you have any questions about this, because I know it was a lot of information, definitely leave those down below. Like this video if you want to see more like this, and then hit the subscribe because I upload videos like this all the time. I want to thank you so much for watching, and I will see you guys next time for my next video.